Health Today is brought to you by Caribbean Alliance Insurance, agent represented by BGI Insurance Limited.
In this edition of Health Today, we take an in-depth look at food allergies in children. Worldwide, more children are battling with food allergies than ever before, and experts are still trying to discover why. Pediatrician Dr. Renita Jagru from the Wells Kid Clinic tells us food allergies in children are more common in Barbados than we think.
We do see food allergies in children for sure, and as the years have gone on, I think it's becoming more and more common. Certainly in the last 10 years that I've been doing pediatrics, I've seen a dramatic increase in it.
She explains that an allergy is a heightened sensitivity to a foreign substance that causes the body defense system to overreact when defending itself.
One person will eat a nut and have no problems with it. Another person may eat a nut and the response could be quite drastic, which can range from something called hives or urticaria, which is the medical word for bumps on their skin that are quite swollen and very itchy, to wheezing, to, in a very severe case, something we call angioedema, which is where the mucous membranes become so swollen that the person can't actually breathe.
The most common food allergies are nuts, peanut butter, cow's milk protein, wheat, gluten, and some fruits, including strawberries.
There's also allergies to, as I said, food substances, which can range from when they drink or eat certain foods, they have tummy pains and even diarrhea. Sometimes they may be even blood in the stool as a result of an allergy to a food substance.
According to Dr. Jagru, more and more, the increase in food allergies in children are being linked to the very early introduction of solids.
We do urge parents to, if possible, hold off until they're about 6 months before you introduce foods. Also, the rate of food introduction is important, meaning things like nuts should be held off until they're well after the age of 2. Eggs as well, if you're going to give eggs early, really and truly should stick to the egg yellow and not bring the egg white in until they're over 15 months. So the introduction of foods is an important thing, and when you start weaning is an important thing. Breastfeeding has been found to be associated with a reduced incidence of food allergies as well. So as you know, we try and promote breastfeeding as much as possible certainly in the first 6 to 9 months of life, if not the first year, if mothers can manage that.
Dr. Jagru points out that severe allergic reactions to food are very easy to pick up, but the problem should be dealt with the first time around.
It is better to pick up what the allergy is, to what food substance, so that we can first of all eliminate it from their diet. And secondly, if the reaction was at any point in time a bad reaction, identify exactly what food it is. For example, when we say a nut allergy, you could have an allergic reaction to peanuts, but not necessarily almonds. Likewise, you can have a reaction to hazelnuts and not necessarily peanuts. So knowing which nut it is extremely important. Furthermore, once a child has been identified with a nut allergy, for example, we make sure that they have certain things like something known as an EpiPen with them, so that if they have the allergy or they're having the reaction, they can actually administer the medication to themselves.
In severe cases, the doctor says the child can suffer an anaphylactic reaction.
They can have more than just the urticaria or the hives, as we refer to it as, but they can also have what's known as angioedema, which is swelling of the eyes, the lips, the mouth, and worse yet, swelling of the larynx and even the trachea. And when that happens, they have difficulty breathing, and you will hear them wheezing, and they will actually say that they cannot breathe.
There are no cures for food allergies. Still, Dr. Jagru maintains there's no need for alarm, and she advises parents and caregivers to focus on prevention.